Joining us in the studio today is Dr. Shane Trevithick. I preached in Truro last year. I'm very familiar, having been in Plymouth as a minister, of Cornwall. That's a great Cornish name. And Shane has been practicing medicine for more than 20 years and is currently a CareFlight helicopter doctor. Welcome, Shane.
Thank you.
And those Cornish roots I'm right about, aren't I?
You absolutely are.
Now, when someone goes to medical school, there are times when you specialise or you do something that you say, this is what I'd really like to do. Not many get the chance to jump out of helicopters and go and help people in the need. How did that vision of wanting to do that come to you?
It took a little while for me to, once I'd started medicine, to get to the point where I realised that was really where I wanted to go. I saw a demonstration at a show from a rescue helicopter service, and they winched a doctor down, and I saw them do that, and I thought that's actually a really good thing to do. So I applied to work for CareFlight and was given a job, and after my first week there, I knew that was what I really wanted to do, to make a contribution.
Now, Shane, for people to understand, you spend half the time in a regular hospital situation and half the time out, as it were, not on the road, in the air, as it were. And the reason for that is so that you're absolutely grounded, as it were, in the right skills, the updates and up-to-date medicine.
That's right. We insist all our critical care doctors who work at CareFlight have to work at least half time in their hospital specialty. And the reason for that is when we turn up and bring the hospital to the patient, we have to be the best doctor that we can possibly be. The most up-to-date, the most practiced, the most capable of performing all the procedures we do in the hospital on the roadside or wherever else we find ourselves.
You use the phrase that you would be familiar with, but paints a lovely picture, bringing the hospital to people, because often many people are in remote areas where they don't have the facilities locally to address the need. And the most obvious examples are on some of those remote roads and highways across the country, aren't they?
That's exactly right. And even in some places that don't seem that far away from the major part of the city, can be quite difficult to get from by road, and a quick 20-minute helicopter trip could take an hour and a half by road.
Have you got a standout experience of something that perhaps to you remember? I remember that instance.
I remember a lot of the work I do. The ones that you remember the best are the ones where you make the biggest difference, where your set of skills bring somebody back from being dead. One patient who really sticks in my mind is young Ashley. Ashley was about 2 years old when she was at home with her parents. Her dad was sick, her mum was trying to cook dinner and bath the 3 children, and in a split second took her eye off the bath that had Ashley in it with the 2 older children, and in that split second Ashley slid under the water and stopped breathing. We responded to the 000 call in our helicopter, and we got to her house in under 6 minutes, landed just across the road. When I got to Ashley, an ambulance had arrived at the same time and put her on a heart monitor. And on the heart monitor, all you could see was a flat line with one heartbeat every 5 or so times, every 5 screens on the monitor, there was one heartbeat. Ashley was the closest to death I've ever seen a patient in my entire career. And with the treatment we were able to give her, we brought her back to life. She spent some time in intensive care, and today she's completely well and healthy and back to normal. And the chance to do something like that is enormously rewarding.
And that must be very energising. And
it's very exciting to be able to make that difference. In a hospital setting where I work in the emergency department, I thought when I started medicine we would make differences like that all the time. In reality, often the paramedics do that before the patient arrives at hospital. And although you do make a difference, it's not really that dramatic.
Just to give people who share in the programme some idea of size, how many of you are there and where do you work?
CareFlight has over 300 employees. We have a base in Sydney with a helicopter, and we have a base in the Northern Territory as well, in Darwin. We have fixed-wing aircraft that move patients around New South Wales, and we have planes and helicopters that move them around the Northern Territory. In Sydney alone, we have over 45 doctors working for CareFlight.
And these are all kinds of hospitals all across the city? They're not in one hospital, they're all over?
Our doctors really only work at major teaching hospitals normally. and work the rest of the time on the helicopters.
Well, it's a phenomenal story. Tell me, I mean, how does faith fit in for you in that kind of situation?
I think to cope with some of the things that we see and to have the energy to keep caring for people, it's really important to have a strong faith. It makes a huge difference in your ability to deliver compassionate care to people. Having an example that you can use to follow, I'm not sure how people could do the job without some element of faith.
Shane, thank you ever so much for joining us today and for giving us an insight. I hope by people looking on the website, the link we're going to make between the two organisations, people will see what that's all about. Thank you so much for what you do and many other heroes across Australia.